patients that come to the office that benefit from a brow lift will tell me that they look tired or angry. And that's generally because the brows descend below the rim of the eye. And it's important to note some of the ideal aesthetics, but for one, the eyebrow, at least in women, should be above the rim of the eye. Men can get away with a little more of a descent than women, but that's generally what we're looking for when we look at brow position. So it's an angered appearance, a tired appearance, and often they'll say, I look so much happier if I do this. So that's what a brow lift does. It will elevate the brow and actually even reshape it sometimes to more of an arch to give a more rested appearance and youthful appearance to the face. We don't want to make the patient look surprised, and that's one of the telltale signs of a brow lift. But we do want to elevate it to a position above the rim that's pleasant looking and youthful looking. A lot of patients will come in and ask for Botox to lift their eyebrows. While it's true that you can put Botox around the eyes and maybe elevate the lateral brow a little bit and change the shape, it's not as powerful as a brow lift. So Botox will not elevate the brow like a brow lift. And in fact, if too much Botox is put into the forehead, in this area in particular, it will drop the brow. And so when women or men come in and they have already low set eyebrows and they have really deep wrinkles in their forehead, which means they may be at rest, or at least they may be constantly using that muscle to keep their brow up. If you weaken it with Botox, and that's what Botox does, it paralyzes or weakens muscles, the brows come down. Brow lifts exist in the endoscopic form and an open form. So the endoscopic approach is where small incisions are made in the hair-bearing region of the scalp. And from under the skin, the brows are internally released and weakened so we can move them. And then they're supported with internal supports called anchors. That's the endoscopic approach. And we have a lot of control over some of the shape and position of the brows through that approach. And the nice thing about that approach is there's really no visible scars, and it's a very safe operation. The open approach is different. This is generally done exclusively for brow elevation years ago, until before the endoscopic approach became popular. In the open approach, incisions are made either through the scalp here, and dissection is carried down to the same area, and the tissues are elevated to raise the brow. The downside to this is not only will you have a scar all the way across your head, and in a man that could be very visible if you have hair loss, right? But the other disadvantage is that it raises the hairline. And we know raising the hairline imparts an aged appearance. So an ideal candidate would be a woman with already a low hairline. The other approach is the incision along the hairline. Through this approach, we can actually resect skin below the hairline to raise the brow and reduce the forehead. It's a forehead reduction combined with a brow lift. The disadvantage, again, is the scar. Now, if you heal very well, that's fantastic. If you don't heal well, that could be a problem. It could be visible. The other issue with these approaches where we're making these incisions across the scalp is potential numbness or even some pain in the area that can be actually months to sometimes, in rare cases, permanent. So they're not without their downsides. For the most part, the endoscopic brow lift has become more popular than the traditional open approaches, but there is a role still for open approaches in the right person. The results are generally immediate. There'll be some overcorrection possibly with the brow lift initially because it will descend a bit over time. So I think the final result will be seen maybe a month or two after surgery when there's a mild descent of the brow. But for the most part, off the table, you will look refreshed.